Hello, my name is Dr. Brian Raid and I'm a naturopathic doctor, and this is a video about the importance of optimizing blood pressure when blood pressure is too low. In general, in our society, I think most people really only think about blood pressure that's too high as being a problem and don't really think about the negative impacts of blood pressure being too low. However, folks with low blood pressure, especially if it's particularly low or if it drops really easily when they change positions, when they're getting up from sitting or lying down, they know how impactful it can be. But some folks don't have really obvious extreme issues with low blood pressure. They might feel a little lightheaded when they get up too quickly or whatnot. But sometimes when they're, say, getting routine checkups, when they're going to see their various clinicians that they're working with, or if they're coming in for IV therapies and we're noticing every time that they get their blood pressure checked that it's, chronically on the lower end of the spectrum, sometimes that can be clinically relevant. And just simplistically speaking, blood pressure is really important to get blood to all of the various tissues in the body. The analogy that I use with my patients is that if you take a shower that has really low water pressure, it's a really inefficient, unsatisfying experience. I'm sure there's folks out there that really dislike good water pressure, and they're like, oh, the slower the trickle, the better. I'm sure that folks out there exist, but I think by and large most of us like a decent amount of shower pressure, and in a similar vein, no pun intended, there needs to be adequate pressure in order to literally push the blood to all of the most distal tissues in the body. So we've got of course our arteries, and then those branch off into smaller arterioles, and then those arterioles branch off into these little capillaries. And to push the blood all the way through into those capillaries, which are only big enough for the width of one red blood cell to fit into, to traverse through the opening of those capillaries, there needs to be adequate blood pressure for that to happen. And so if the blood pressure isn't high enough, then the blood can't get to all those tissues, and then it therefore can't transport the oxygen and the nutrients that are floating around in the blood to all of those tissues. And so some people will feel more tired. They won't heal as quickly. They will have other symptoms. I've talked in past videos about the importance of mitochondrial health and function, and I talk about that with my patients every single day in practice, because my patients are generally having issues with fatigue and brain fog and pain issues, and their bodies just aren't recovering and healing as quickly as they should from various onslaughts, things like mold and chronic infections and heavy metals and various other things. And and so with the mitochondria, really important for them to get all the nutrients that they need to make energy. But if the blood's not able to transport those nutrients to the tissues, particularly oxygen, which is the most important nutrient for energy production, or the most important substance for nutrient production, or energy production rather, then it's not going to work nearly as well. I've had patients who are doing, incrementally better as we're detoxifying them and killing off the infections they're dealing with, and they're working with mitochondrial support nutrients and antioxidants and different therapies that we're implementing. And but it isn't until we get their blood pressure on track that they notice the biggest gains. In some cases, in other cases, we never really have to look at their low blood pressure at all. Lots of people with chronic symptoms don't have low blood pressure in the first place, but if it is present, it's really, really important to address that. So it's something where if you're dealing with chronic health issues and you're not sure if your blood pressure might be playing a role in your chronic health issues, I would suggest that you consider talking to your healthcare provider about whether that might be important for you. So I hope that information is helpful. If you have any questions, just post them in the comment section below, and I'm happy to reply, or maybe post a video and reply at some future junction.